So, hello everyone, and welcome to another episode of Thera Biz Solutions Podcast. I'm Shikha Kaushik, your host for today's conversation. At Thera Biz Solutions, we work with the mental health professionals and life coaches to help them build stronger visibility, establish credibility, and grow sustainable private practices. Today's conversation focuses on a topic that many professionals are curious about, but also cautious about: artificial intelligence. How can we embrace innovation without compromising ethics? How can AI reduce administrative burden while preserving the human connection that defines our profession? To help us explore these questions, I'm delighted to welcome Dr. Marina, and I'm going to go with it. She will explain her full name. Dr.
Yes.
So, Dr. Marina is a licensed clinical social worker, educator, consultant, and a founder of the AI Social Worker. She serves as an adjunct professor at New York University, Columbia University, the University of Kentucky College of Social Work, and Louisiana State University. Wow. Where she teaches and mentors the next generation of social work professionals. Dr. Marina also holds the concurrent roles of board secretary for both the National Association of Social Work New York State chapter and the School Social Work Association of America. Dr. Marina, thank you so much for joining us today.
Yeah, no, thank you so much for having me as well. And please definitely just call me Marina throughout today's session. And I'm happy to share a little bit about myself if you want me to do a little bit more of a further introduction
Yes,
for,
definitely.
yeah.
That's what I
So,
was
so
about
yeah.
to ask first. That please give yourself a brief introduction.
Yeah, no, well, thank you so much for sharing a bit about my background and the work that I do. And so, yes, I'm a professor. I teach courses on AI and social work and postgraduate courses on AI and mental health across a number of different universities. And I also have my brand, the AI Social Worker. I provide a lot of free resources and information for the social work professions and just mental health professions in general on ways to integrate AI ethically and responsibly into practice. And over the past few years, since the fall of 2023, I've been on this journey to conduct trainings, workshops, webinars across the US and Canada, and even globally as well too. I've trained over thousands of social workers and helping professionals as well on integrating AI ethically and responsibly. That's a bit about the work that I do.
That's not a bit, that's a lot. You're kind of an inspiration to so many people. And we are very
Thank you.
delighted to have you here.
Thank you. Thank you.
So, my first question first. Artificial
Mhm.
intelligence has become one of the biggest topic in healthcare today. I mean, every single person asks this question. So, from
Mhm.
your experience, what are the
Mhm.
biggest misconception therapists and the social workers have about AI?
Yeah, and this is such a great question because there really are mixed reviews and understandably so. Rating the profession, especially the helping professions, we care deeply about our clients, we care deeply about the communities that we're servicing. And so, professionals like social workers, therapists, they're concerned about the potential harms that AI could provide for clients. And that includes the harm of these AI chatbots. We've had, unfortunately, cases of young people who've been dying by suicide because
Yes.
of these AI chatbots, because of lack of guardrails and training. So that's one of the large concerns around AI and mental health. But of course, the other concerns around privacy, data, security, that's a major concern. Along the lines of just even the environmental impacts around AI. But I also believe at the same time, or should I say, and there's some real opportunities with this technology. And I think a misconception is that this technology is completely new. And
Hmm.
it isn't. The first AI mental health chatbot was actually built in the 1960s by MIT researchers who wanted to know and better understand how people can interact with a chatbot for therapeutic support. And AI has been around for decades. It's not new. So while I completely understand the real concerns that folks have, and there are real concerns, I think a misconception is that this is completely new, but this technology has been around for decades.
I think that's right now we got to know, okay, this is the technology. Earlier, it was only for the people who have only, researched about it or have gone into details. They know that this is something that we already worked on, and this is something that it's nothing new. But now, because it's ChatGPT and everyone knows about it, so
Yes,
it's,
there's a
it's
lot more awareness these days. Yes,
yeah.
I
So you
agree.
have
Yeah.
trained thousands of social workers, educators,
Mm,
and clinicians across US and
mm,
Canada. What
mm.
concerns or questions do professionals ask most often when they begin exploring AI?
Yeah. So when they begin exploring, I think one of the major concerns or just that social workers have is just, I just want to make sure I'm using this ethically and responsibly, right? That is uh, definitely when they're starting to explore these platforms, practice with prompting. A concern is, well, how do I make sure I'm using this correctly and ethically? And I think that's
Mm.
important. I think that's a great place, right? And a great question to ask. This is why I do these trainings because we're beholden to our core values and the ethics of our profession. And so social workers want to make sure that they're not putting in any information that is identifiable, especially these free tools that are out there like ChatGPT, Claude, Gemini, Copilot. These free tools, these companies are collecting a lot of data. They're selling that data to third parties. These are not compliant, secure tools. The work around that I always share in my trainings is that when agencies purchase these AI tools, and the most common ones that I see that agencies are purchasing are Gemini, which comes with the Google
Yes.
suite, or Copilot, which comes with the Microsoft 360 suite. Those are the two most popular ones. When the agency purchases that tool, it comes with the business agreement. It becomes with security and compliance. I don't recommend to just put any client information in there still. I'm more on the conservative side, but it is a much, much safer alternative than using these free tools. And of course, always making sure that you're prompting without putting any client identifiable information. And of course, always reading through, double checking, critically analyzing, assessing any of the information and content that AI generates and creates because it could be biased, it can make mistakes. And so we definitely have to check for accuracy and edit as we see fit. Those are some basics around
So
that. Mm-hmm.
basically, you are suggesting us extra paperwork, right?
Extra time. I know AI can save us some of the time, but you're right, right? There's still extra steps that need to be taken.
Yeah.
And that's just part of responsible use. And so it's a great point that you make.
Okay. So actually, I've got a question that is similar to this.
Yeah.
So,
Yeah.
many clinicians spends hours. That's why I was asked that you are spending just, extra hours because we already spend hours every week on documentations, emails,
Yes.
treatment plannings, and other administrative work. So, which
Mm-hmm.
tasks can AI genuinely help with while still allowing us to professionally maintain the ethical and a high quality care?
Yeah. So I think you definitely named it, right? And research is also showing this as well too. There was a recent study, even coming from the United States, the NASW had a partnership or collaboration with the University of Texas. The study was just published in June of this summer, looking at the trends of how social workers in the US are using AI. And a lot of the one of the main sort of takeaways from this report was that yes, social workers are not only using AI, but they're using a lot to support with documentation, research. That's another area as well, supporting with writing emails, documents, notes. And I agree. I think there's real time saving benefits to using AI for these sort of administrative, low level types of support. I'm a social worker. I know firsthand just sort of the burnout, the challenge, the need of getting paperwork done within 24 hours and how time consuming that could be. And I think AI could provide a great opportunity to assist in whether it be creating drafts or whether it's editing and revising content or writing that you've already done. But the most important thing is we can't just trust at face value what AI says or the edits. You have to definitely always read over, edit, refine. That's really important. Where hopefully that gives more mental load, sorry, that gives more opportunity and reduces the mental load, and it gives you more freed opportunity to then reflect on your sessions, engage with clients, do that, human centered, human facing work that we do. and sort of leaving AI to support with those sort of administrative tasks. And I always, share as well that we should always leave the crisis, the high level sort of judgment making, diagnosing, that should always be reserved for the human. That should be relying on human intelligence and not artificial intelligence. We still need our human centered professional judgment in order to do those high level, human facing, engaging kind of work that we do.
What if our clients comes up with an AI manual and says, "Oh, I have already checked with the AI psychologist, and I think that I am safe posting this." Then, because that
Yeah,
happens a lot.
it is. No, you're bringing up such a great point. And I've talked to, thousands of clinicians and social workers. And that is the reality, right? Clients are using AI. I mean, millions of people every week are turning to tools like ChatGPT for their medical support, mental health support.
Yeah.
They're asking advice, and now that's coming into the clinical space. And I think this is definitely a clinical opportunity for us to talk to our clients about how they're using AI, what are they using it for, how often, how is it impacting their daily life, and also providing that psychoeducation, because we know AI can make mistakes. It should never replace the professional expertise that we have as clinicians. But are there opportunities in this clinical space to use AI as a tool and support? And there's certainly research that's exploring that. There's clinicians who are actively incorporating these tools that clients are bringing in their conversation with AI and processing it in the session.
That's the clientele
Mhm.
side. Now there is one other question that I have a therapist side. So,
Yeah.
as a therapist, there is the concern
Mhm.
that raised up. If I use AI, am I compromising my professional judgment? How do you
Mhm.
help the clinician understand the differences between using an AI as an assistant versus
Yeah.
relying on the decision making? Because sometimes it's very easy, you just have a test and you have get
Yeah.
like, okay, just help it down, because why not? When the clients are using it, then why can't we do that same?
Yeah. So I think this is such a key distinction of, making sure that AI is being used as a tool rather than being, taking over our professional judgment. And I think this is so important for us or as a person, as the professional, of relying as AI to, for research, for getting ideas. But when it comes to, diagnosing a client, we're not just typing in all these symptoms and saying, okay, what's the diagnosis, copying, pasting that, and putting that to the client record. That is not acceptable or ethical practice at all, right? You are the clinician, you're the therapist, you're the one who's sitting and doing that intake, doing that biopsychosocial with the client. You're hearing their stories, you're actively listening, you're asking the open-ended questions to gather more information. And based on your own experience, training, that you're the one who's giving the full diagnosis for that client, right? And you're not just offboarding that into an AI tool and having that do the thinking and diagnosis for you. I think for me, that is a clear sort of distinction of the unethical use of AI and needing for us to still rely on human intelligence, our practice wisdom, our training and experience. Again, similarly in the medical field as well. I don't think we would want our doctor to fully rely on AI to come up with our diagnosis. Are there ways
Point.
of using the AI tool as support, imaging, scans, finding research, but we're not just inputting all the information into an AI and having it make that decision of um, what the medical diagnosis is.
All right, that sounds actually
Mhm.
quite reasonable.
Mhm.
I got a similar question with similar things. The
Yeah,
confidentiality, privacy, and the ethics are the fundamental of our profession. What
yeah,
practical guideline should every mental health professional follow before using AI in their practice?
yeah. As I mentioned earlier, um, having a paid tool gives you so much of an advantage to having privacy and security measures when using an AI tool. Now, any AI tool that I mentioned in our conversation today, I get no kickbacks. I don't get any sort of sponsorship from these tools. I just do this work because I love it.
Okay.
But there is a tool out there called Bastion GBT, and this is a HIPAA compliant where it is private, secure, and it has ChatGPT technology in it. It's not free. this is one, I think, one of the drawbacks, right, of some of these, paid tools out there is, yes, they cost money, but I think the benefits of it is that it gives you so much more privacy and security. And I think this is something to really consider if you're thinking about incorporating a tool into your practice. Because again, I think this falls in line with ethics, privacy, confidentiality, that I think this gives you way more privacy and protections when you use a tool that is like HIPAA compliant, like Basti and GBT, for example. And there's others out there too. I mean, there's platforms like Upheal. This is also kind of like a one-stop shop for clinicians. It has an AI scribe that is able to listen in on the sessions, generate a note, build out treatment plans. It uses AI to do an analysis of sessions to kind of pull out key themes using AI. Again, this platform, has built-in privacy security measures built into it. And so one of the benefits, again, is that it provides a lot more security and privacy when you purchase those tools and you do your research and vet to make sure that they have these privacy security measures built into their platform. I think that's one of the biggest advantages. I know there's a cost associated with it. So let's say you're at a position where you can't afford to purchase a tool. I do want to also name there is a tool called Berries AI. This is free up to 15 sessions a month to get an AI scribe. It is built with privacy security measures, HIPAA compliance as well too. And then also if you're going to choose to use a free tool like ChatGPT, Claude, Gemini to never input any identifiable information. That means no addresses, telephone numbers, client's name, addresses, telephone numbers, right? All that information cannot be entered into those tools. It's so important that you prompt, again, with strategically that you're putting in more general information and nothing identifiable to that client. And another piece that I want to make sure I also emphasize when you're considering, onboarding and using a tool, to also get the informed consent and transparency with your clients. I think this is also just sort of the wave of what's happening even in medical care too. A lot of hospitals, doctors, nurses, they're also utilizing these AI scribes. And it's so important to provide clients informed consent, fully describing what these tools are, what AI is, the privacy of their data. And so clients can make an informed consent whether or not they want an AI tool as part of their care. So I think these also need to go hand in hand, that you need to vet your tools, check privacy and security measures, and then also providing the informed consent and transparency with your clients. And if your client says, no, I don't want an AI tool used in my care, then you follow client determination as well. You don't use the AI tool.
Basically, go to the old ways.
Yes, what we traditionally always. And I've also seen, some therapists are even advertising no AI is used in this practice or in this clinic. So I also want to acknowledge, right, we're seeing the full spectrum of no AI being used to AI being integrated into practice as well.
I think that is pretty important. Not that I'm against AI or something, but sometimes you don't have any idea that how much AI is okay and how much AI is not okay, especially now when everyone is so informed that they are like, you are selling my security, you're selling my, so they are quite very informed about it, especially the clients. I mean, if a client can come to you directly and can tell you that I have already done my test, I am suffering from this, so just help me, then they have a very high knowledge about, that how much security can, how much information he wants to give to AI and how much information he doesn't want to give to AI. So probably
that's a great point. Yeah.
So my next question to you, looking beyond individual clinicians, how should private practice agencies and educational institutions prepare for AI? What policies or leadership practices do you believe will become increasingly important?
Yeah, so there's definitely a couple of things. I think one aspect is certainly training, right? I think, and this is even part of the British Association of Social Work. They've developed AI guidance. They're actually one of the only ones across the entire globe that have specific AI guidance for social workers. They talk about how important training is for the profession. And we need AI literacy. We need to understand what AI is, how it works, you know, the different components of, you know, how these tools, how to prompt, right? These are concrete AI literacy skills that we need. We need to understand how AI is biased, how it's trained. But then we also need AI fluency. And this is where decision skills come into and professional judgment. It's not just that I know how to use AI, but how can I make decisions around it in my practice of when to use AI and when not to use AI. And I think these are really important skills for our profession. This needs to be taught to those that are already in the field. This needs to be taught to those that are up and coming in universities, in our BSW programs, MSW programs, or doctoral programs. We have a real opportunity right now to support with AI literacy and training. And a second component of this too is around developing AI policy. And that was also one of the main sort of takeaways from that study that I mentioned earlier coming out of the University of Texas and the NASW, is that there was a huge call to action that we need more guidance. And this should come from not only our professional, you know, governing organizations that we have in our respective countries, but also to the more local level, even within our own agency, that agencies need to develop AI policy for their staff. And AI policy is needed because we not only need protections for the staff, liability, right, for clients and the staff, but also you know, we need containment and boundaries on the way that AI can't be used and the way that AI can be used. What are the vetted appropriate tools? What happens for accountability if AI is inappropriately used? And there needs to be, you know, a stakeholder sort of at the table of not just administrators developing these policies, but client input, staff input, IT input, HR input. We need a variety of voices to really come together and develop these agency policies. And it shouldn't just be, you know, one and done. We develop our policy and now it's over. This should be a continuing, ongoing document that gets updated over time as well, too. So I think we have real opportunity for training and policy right now.
Yeah, I got another similar question for that, and you just
Mhm.
spoke about it. I was about
Yeah,
to ask that as a someone who works in the intersection of technology and social work, what
yeah.
opportunities do you believe as a mental health professionals are overlooking because they are, hesitant about or uncertain about using the AI on their services? And you
Yeah.
just mentioned
So
about it.
yeah, and I just want to make sure I'm hearing your question correctly.
Yeah.
Do you mind just repeating it again one more time just to make sure I answer it correctly?
Definitely.
Yeah.
As someone who works at the intersection of technology and social work, what opportunities do you believe mental health professionals are overlooking because they're
Oh,
hesitant or uncertain about the AI?
yeah. Oh my God. Yes. And you're right, right? This is a huge opportunity to provide training, to provide policy. But I think there's even an opportunity too of even working at these companies, right? I think this is a huge advantage that social workers, mental health professionals, we have the understanding of ethics, confidentiality, privacy, security, trust, and safety. I think we have a huge opportunity in this profession to not only be part of these companies developing policy, trust, and safety guidance. But I think even the opportunities of even designing AI, because we have a better understanding, especially of marginalized communities, communities like those with disabilities, cultural relevance, and practice. You know, these are opportunities that these tech companies aren't necessarily trained in, but we come in with that knowledge and understanding. So I think there's a real opportunity for partnership with mental health professionals, social workers, working alongside engineers and IT specialists to then build out these AI platforms. And I think there's even a real need for participatory community sort of action and research where us as mental health professionals, social workers, that we have the real skills to do those interviews, those focus groups, to be able to ensure those marginalized voices are part of this movement and revolution and part of these companies and giving the feedback so that we're building tech platforms that are really responsive and ethical in their design for the public.
Wow.
Yeah.
So now let's just wrap up. So, wrapping up the conversation, that is something very important, and at the same time, because I think so, I have learned a lot. And this is the
Well,
only
I'm
time that
glad.
I've actually spoken a very less about. Otherwise, I'm very talkative, and I'm just like, okay, okay, we can do that, we can do that. And so it was a very
Yeah,
nice
yeah.
conversation having it. So
Thank you. Thank you.
if every
Mhm.
therapist, counselor, psychologist,
Mm.
social worker, and a coach watching today
Yeah.
remember just
Yeah.
one message about AI, what would you hope that message would be?
Remain, remain human. That is definitely my takeaway, even though I am
Uh,
the AI social worker and that's my brand. I
mm,
do want to, the takeaway is remain human, remain engaged in this work with clients. Use AI if you want to as a tool, but the work that we do is so important. That human connection, that relationship, the questions that we ask, the empathy, the validation, the support that we provide should always remain human centered. So keep doing that human engaged work that you do, and AI is just the tool to support the great work that we do with our clients and communities.
so Dr. Marina, thank you so
Yeah.
much for joining us today and for sharing your knowledge and experience. At Thera Biz
Mhm.
Solution, we believe that staying informed is one of the best ways to serve our clients, strengthen our practices, and grow professionals under the leadership of our founder, Sajid Mola. We are committed to bringing experts from across the profession together to share practical insights, staff, therapists, counselors, psychologists, social workers, and coaches that can apply in their everyday life work. To everyone watching, thank you for spending your time with us. We hope this discussion has given you a practical ideas, thoughtful perspectives, and the confidence to continue learning about the AI in a responsible and ethical way. If you found this conversation valuable, please consider sharing it with the colleagues who might benefit from it. Thank you for watching it, and we will see you on the next podcast of Thera Biz Solution Podcast.
Thank you. Thank you